topic today is osteoarthritis. What is osteoarthritis? It is the most common form of arthritis. It is strongly associated with aging and typically affects the knee, hip, spine, great toe, hands. Let's see what happens in osteoarthritis or how it is characterized. Mainly, it started with thinning of cartilage or cartilage damage, then loss of joint space. As a result of injury to the joint, there is osteophyte or bone spur formation. Ultimately, there will be bony deformity, changes in osteoarthritis. There is a graphical picture on the left side. It is showing the same changes we discussed before. You can see on this picture the left part of this joint is normal and the right part of this picture showing the osteoarthritic changes. So let's look at the normal joint first. You can see there is two bones. The upper bone is demarcated here, and there is a cap of cartilage lining the end of the bone. Similarly, lower bone also has the lining of the cartilage. And then there is a joint space in between, which is filled with synovial fluid or joint fluid. And we can see there is a strong capsule or membrane or covering of the joint. There could be two parts. One is a joint membrane here or synovial membrane, and there is a thicker, stronger joint capsule there. So these two parts actually covers the whole joint, and inside this covering there is a fluid which we call joint fluid, which helps the joint move and function. Now we're going to see the damaged part of the joint, the osteoarthritic changes. We're only going to discuss about the osteoarthritic changes here because our topic is osteoarthritis. There could be other joint damage from other arthritis, but here we're going to only discuss what happens in osteoarthritis. As we discussed before, there is mainly two components of joint damage in osteoarthritis: damage to the cartilage, damage to the bone. In the beginning phase, an early phase, it starts with a injury or damage to the cartilage. Initially, the cartilage will be broken or thinned out or destroyed adjacent to the bone. So you can see how smooth the cartilage here and how ragged cartilage which is damaged due to osteoarthritis. And also in the lower part you can see more damage or thinning of the cartilage. So once that happens, the space in the joints between two bones will be narrowed, and which is the X-ray picture of the similar damaged joint we can see in the right side, and we can see there is a bone on bone. There is no cartilage left here, no joint space left here, but compared to the other side of the joint, you can see significant amount of joint space here, but there is no joint space here. That is the end result of this kind of injuries or damages due to osteoarthritis. Now discuss those specific other changes. First, the cartilage damage, and then what happens is once the cartilage is very thinned and inflammatory or non-inflammatory changes happening locally, the adjacent area of the bone also started remodeling or scarring, which is another term for sclerosis. Then we can also see osteophyte or bony spur formation, but it is not happening the area of injury but adjacent outside part of the bone. So that's why we see some deformity. Deformity happens due to joint space loss and cartilage loss here, as well as this new bone formation that is not supposed to be there. And that's why sometimes we see nodule, a bump, a lump around the joint, which is a bony or solid in nature. So this is mostly the joint damage here. We can see in a bigger picture the same changes, more clear picture, and you can see the changes here. And other than the cartilage and the bone changes, the capsule and the membrane also changes. You can see in the left side of this picture is normal thickness of the membrane and the capsule, and you can see how thick it became because of the injury, chronic injury here. So that also gave an abnormal appearance of the joint. Why do we have these kind of changes? Why the younger people or children does not have osteoarthritis? To explain it, we have to understand that when we were young, we were able to repair damages to our bodies. So if we think about the joint, when in the younger age, if we have injury to the cartilage, there is a intrinsic mechanism to repair itself, and once the repair happens, the further damage does not happen. So we lose those ability to repair when we are 30, 35 or 40 years old. In this picture, we can look at real joint, how the cartilage is damaged. On the left side, there's a normal joint during a procedure or surgery. We can see the bottom part of the femur, and which is a part of the knee joint. It looks shiny. The cartilage is normal, and on the right side there is an osteoarthritic knee, and which showing the wear and tear in the surface of the cartilage. And comparing both of them, you can see the healthy cartilage in a joint, and this is the damaged cartilage in the joint. So obviously we can understand that this is wore off, and this is really damaged part due to osteoarthritis or injuries.